Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
The psychiatric mental health nurse practitioner is evaluating a patient who has presented for care repeatedly, reporting that she is bipolar and has manic episodes. She has been medicated in the past with a number of mood stabilizers without any meaningful improvement. Today, a more detailed history reports that what she is calling manic episodes are actually periods of dramatic responses to stressors. When she argues with her significant other, her mother, and even people at work, she becomes very animated. In response to stressors, she is very dramatic and defensive, will react in an erratic fashion, but then often within hours goes to extremes to try and explain her behavior and make amends. She clearly struggles with being alone. Which of the following diagnoses should be explored for this patient? A, bipolar disorder with mixed episodes. B, schizoaffective disorder. C, adjustment disorder with anxiety features. Or D, borderline personality disorder. And while it may seem pretty straightforward here in question form, in clinical practice, it's amazing how often it isn't quite that overt and obvious, especially to a new clinician. You know, I precept NP students a lot, and this is something that very commonly will come up with a patient, and we have to talk about it. New patients will come in, existing patients for that matter, but new patients often that are being evaluated, they may have transferred from another provider, they may have been investigating their symptoms online or getting their healthcare advice, help us from TikTok or something like that, and they log in telling us that they have bipolar disorder. They come in saying, I have bipolar. And very often, over a period of months or years with other providers, they may have been trialed on different mood stabilizers or antipsychotics that we use for bipolar disorder and really don't have much of a clinical response. And there's a lot of potential reasons for that, but one of them is that they don't actually have bipolar disorder. As we look at these answer choices here, D is hands down the correct answer. Patients with borderline personality disorder often think that they have bipolar disorder when they research their symptoms online. And yet, clinicians, new clinicians, experienced clinicians may even confuse the two. In fact, the term border polar is being used now to identify patients that have features of both. And while, that certainly is possible, there's nothing new under the sun, many patients with psychiatric diagnoses also have personality disorders that coexist. But this business of teasing out bipolar from borderline, it's important because they are treated in very, very different ways. One of the key features is the duration and character of the manic episodes. This patient tells us that her manic episodes last for a matter of hours. And that's always one of the things that you want to drill down when people tell you they're manic or describe their elevated mood. A, you want to know what's characteristic of the mood, like give you an example of what they're talking about when they say manic. And then B, how long does it last? When they tell you, and you may have to ask a few times to pull this out, but when it becomes apparent that their manic episodes might last minutes or an hour or a couple of hours, never more than a day, it's not a manic episode. Manic episodes are several days in duration, minimally, and patients that are manic usually will be engaging in some sort of purposeful activity, whereas the highly erratic, dramatic response of a borderline personality tends to be exaggerated for a very short period of time, and they really don't accomplish very much at that point. Borderline personality disorder, or patients with borderline personality disorder will often have, they're going to start a project or they're going to start a thing, but never really finish it, whereas the true manic episode typically does. So for this patient, her episodes are lasting a matter of hours, and they are clearly in response to some trigger, something that's upsetting her. And that is also characteristic of the dramatic episode of a borderline personality rather than the manic episode of a true bipolar disorder. And so be on the lookout and watch for it. Like I said, in questions like this, it's pretty easy to tease this out because no doubt you were taught about this in school, but I see this happen all the time as I'm precepting students. The patient says they're manic and that's it. It's just presumed a manic episode, and they don't go on a whole lot further to try and quantify it and characterize it. And on a side note, not having anything to do with this question, but another thing to be on the lookout for is when patients have a history of depressive episodes and then they talk about when they are manic or they have an elevated mood or they're having mood swings. For some people, normal mood is such an extreme opposite that they think it's a mood swing. So patients who cycle between depressive episodes and normal mood have major depressive disorder. Bipolar disorder really needs to be characterized by both those true depressive episodes and then true elevated moods that you can explore using your mnemonic dig fast. But you really need to characterize true mania with respect to what's happening to the patient, what are the symptoms, what are the actions, and how long does it last.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.